We're going to go through each of the testing options alongside with what's going on in your cycle. So we've been through cycle tracking, these different phases of your hormones and or the moon phases. We're skipping on away from the elements, more into the hormone symptom checklist and labs. Feel free to have your quiz results polled and a list of your most common symptoms. You also had a chance to schedule with me in the last module, and I'll also give the same scheduling because you might be more interested in testing after we review this. So remember dreaming about when we could actually look forward to having our period and enjoying the rest and no longer having to rely on birth control or painkillers during our period and cramps, and how we're no longer accepting things. This is medical sovereignty. The concept of medical sovereignty is the fact that we are not going to have to rely on the doctors and medical system for our own testing knowledge and hormone knowledge, and we will have options. Of course, go for birth control if it is something that resonates with you, and know that there are other options and that you don't have to feel sick anymore, and that you don't have to just have one normal month out of the year. We're learning how to relate into our body sensations. Here, remember the symptoms of the hormone imbalance. All of these, and then some more, the canaries in the coal mine. So now we're going to go into symptoms and testing types, and we'll do it phase by phase. Take note with your symptoms if you've been tracking in each phase, and look at your hormone quiz. Might give you some clarity at the end. And remember, of course, this is about relationship with ourself, relationship with the elements, and relationship with our bodies first, and then outwards. Here's the forest view of what the next slides are going to look like. So we're going to start here down at water or new moon menses, and a review of the signs and symptoms. If you're having heavy bleeding, fatigue, I'm going to attach the PMS checklist for you all. Into the waxing moon, follicular. Is there an estrogen deficiency? How are your eggs producing? Whether you're trying to get pregnant or not, this is a sign of vitality. Is your energy increasing or is it not? In ovulation, is your temperature rising? Is there a thyroid problem? Did you have cervical mucus? Was it painful? Did you experience hives, migraines, etc., or mid-cycle bleeding, which sometimes can be a sign of parasites? And into the luteal. Did your temperature lower after it raised? Is that a sign of thyroid imbalance or some type of metabolic shift with cortisol, or a luteal phase defect? Have you had multiple miscarriages? Do you get inflammation, brain fog, PMDD or PMS, or sleep issues during this? Learn how each testing is associated with that. So here we are moving on to menses and bleeding. Let's start at the bottom to keep things consistent. Signs of bleeding, normal, abnormal. I need a little bit more room here, so sorry about that. So for normal, want to bleed about 25 to 80 milliliters. Some people consider heavy bleeding over 7 days or 60 mils. And then clots under a quarter size are normal. Once you start to get clots that are a quarter or bigger, then that's abnormal. PMS is not normal. A little bit of fatigue is day 1 and 2, but not to the point that it's really, 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 truly interfering with your life. Let's see, 60 mils is about 2 ounces. And we'll go through what like a tampon filling, like basically if you have to shift your tampons every 2 to 3 hours, that's heavy bleeding. The menstrual cups have the measurement, or if you're having to use multiple products to contain your bleeding from leaking into your pants. Around here, bleeding is the structural issues. So fibroids, polyps, PCOS, and endometriosis. We'll talk about labs for imaging. And inflammatory can also be a structural issue, like inflammation in the cervix or the uterus. And so this can be caused by IUDs or intrauterine devices like the Skyla, the T-ring, or a copper, or PID, so an infection, can cause inflammation. Symptoms of estrogen being high, PMS or PMDD, painful menses, painful ovulation, big clots, heavy bleeding. Symptoms of low estrogen, PMS, PMDD, brain fog, clots, mid-cycle bleeding, scanty bleeding, or amenorrhea or dysmenorrhea. Amenorrhea, no bleeding, also can be caused by extreme stress. Hypothalamic amenorrhea is number one, meaning stress is stopping your period. Imagine how much stress affects our hormones if it has the power to stop our period like that. PCOS or androgen dominance is also another reason for that. So we're just talking about the menses and bleeding. It might be good if you're having a lot of pain and you're trying to work on your hormones, it might be a good idea to have a pain intensity scale on your Read Your Body app. And the pain intensity means that your period stops your day-to-day life for more than 2 days. All right, so here, this is just a little review of what we talked about. And here are the clues or the canaries in the coal mines to look for. Heavy bleeding, must change a pad or tampon every 1 to 3 hours. We want to look for hormone imbalances, fibroids, polyps, endometriosis, or bleeding disorders such as von Willebrand factor 5 Leiden. Anemia can cause heavy bleeding. Heavy bleeding can cause anemia, which then causes heavy bleeding. This could also mean that you're going to have difficulty getting pregnant and an increased risk of miscarriage. So more than 7 days of bleeding will definitely cause an irregular ovulation and issues with clotting and disruptions to the uterus lining, hence the trouble getting pregnant. So here you're going to have the fertility lab handout below, which goes through each and every single hormone, what they mean and what optimal versus normal is. We will go into that in a little bit, but optimal being what the World Health Organization has found with people getting pregnant. I think of pregnancy and ability to grow life as vitality, right? As ultimate health versus normal, what the medical system accepts. And, you know, it takes about 16 years for research to go through, and then about another 15 years from that for it to become a standard in medical practice. So those would review all the hormones. Anemia panel. You want a complete anemia panel. Most doctors will just order iron, but guess what? Ferritin is the storage version of iron, and then there's also total iron binding capacity. And you can find all sorts of interesting anemias and bleeding disorders through looking at that, along with a CBC with differential. That just means complete blood count, where somebody manually looks to see if the cells are abnormal in shape, size, or color. And this would, you would be looking for macrocytic anemia or vitamin B deficient anemia. And you can run some, or request for your doctor to run vitamin B, like B12 and folate is common, and magnesium, and then also iodine if you're having a lot of cystic breast. Thyroid is a really huge cause for dysmenorrhea, and it is the most common autoimmune disease, period. Really freaking common in women. And yet, most doctors just order TSH, which is the brain's response to what the thyroid is doing. Free T3 is the active thyroid hormone. And so you would love to see that and see if it's at an optimal level. You can look at that on your fertility handout. And then free T4 to see how they're converting. This is meant to say total T3 and total T4. And then, of course, thyroid antibodies. So Hashimoto's antibodies, there's two. There's a TGO and TPO antibodies. TGO is for Graves or hyperthyroid. TGO's is Hashimoto's. And the reason that you want to know all of these lab names is so that you can advocate for yourself in order to ask for them to be ordered with your doctor. So you can have high antibodies that make your thyroid levels do this with a normal TSH and a normal T3. You're just catching it at a time that maybe you're not having as much immune inflammation. What's significant if you have thyroid antibodies? Can really affect your period and your hormones, highly affects your ability to maintain in a healthy pregnancy and get pregnant, vitality. And you're going to have to make some dietary changes if you have positive thyroid antibodies. Bleeding disorders such as factor V Leiden, extremely important. Remember the structural reasons: fibroids, polyps, endo, or cyst on your ovaries. You want to ask for ultrasounds. Endometriosis is wildly underdiagnosed, because they actually have to go in through laparoscopic surgery to look at the uterus and search for endometrial cells. A lot of women with endometriosis out there, and it's one of the number one reasons for not getting pregnant. And they have found that over and over again through research. Another image is like a saline flush. So this is for those of you that are trying to get pregnant, that looks to see if the tubes between the uterus and the ovaries are clear. We as women are 40% less likely to receive the imaging and labs that we're asking for, because doctors' perception of our pain tolerance is that it's all in our head. You take that and you compound it onto white supremacy in medicine. A black and brown woman, a black and or brown woman is going to be way less likely to be listened to, or trans issues in medicine. It is really sad. We really, really have to find doctors that will listen to us and know that we know our body in order to get the testing that we need to find the answers that we need. Don't give up. And if you have any doctor recommendations, put it on the community forum. So we're going to go into follicular and estrogen next, and finish up through ovulation and the luteal phase, and then into some of the functional medicine labs. Be sure to go ahead and download and save the fertility lab and other recommended labs for your blood work analyses. And we will talk about estrogen medicine and follicular phase, ovulation, and get really excited about all the other labs that you can order, the fun functional medicine labs, in the next bit. I hope you have a lovely day. See you soon.